Your labs are fine. Because it's your first pregnancy, and you're still on the side of the hill for older moms or very blood pressure affects young person moms and older person moms. If you have a baby in your 30s, you're not immune or anything, but you're at a lower risk. Head down. I'm going to be honking someone. Posterior placenta. Yeah, it was a little bit more focused before. Cute. Oh, she's okay. I'm telling you, really unattractive babies when you see her living right. Well, couple areas.
When my niece was born, there was a baby who did not lose his womb hair.
What is it called? Lanugo or something? Yeah.
Well, I know it
was like a monkey?
Yeah, a werewolf baby.
The wolf baby? Yeah.
So what did I say to you?
I am making split. That's a real important thing to check for with high blood pressure. Sometimes the high blood pressure will cause the placenta to age a little quicker than normal. And the placenta is a little older than normal. Okay, it's perfect around this baby. 17.8, that's really regular. Then I'm going to measure her size. If blood pressure can affect placenta, then placenta can affect size. Were you observed at Baylor or at
Baylor.
Oh yeah, because there are offices on the Baylor campus now. I will sometimes forget that. Well, I knew that Ward knew, but also Wilbur and Bailey were doctors.
Yeah. Because they joined together.
Mm-hmm.
It was very confusing because she left on her maternity leave and came back to the new office.
I know. So I'm glad you found her.
Not her big head.
No, it's not big head. Super excellent. Super excellent doctor. I found it. She's great.
So her head isn't big?
You got lucky.
I had a giant head.
Well, my house is. No, sometimes personality is not that important.
Well, he had a big head as a kid. He's kind of started to it. It was
I just love how the compliments flow and understand. How the baby has your nose?
It's just, I just wanted to be able to come out okay without a giant head.
I understand.
What's that?
The leg, the height on the length, I guess I should say. Yeah, that's really good. She's perfect size here. Have her at 5 pounds, 5 ounces. If you've had a recent ultrasound, she might be kind of similar to that. Hopefully she's not smaller.
She was 4 pounds, 10 ounces according to them on last Tuesday. So,
you have to understand, when we measure these babies, there's a 13-ounce deviation. Don't worry, you didn't eat anything that made her pack on the pounds. It's just their equipment versus my equipment and their technique versus my technique. In reality, it's probably somewhere between probably like 5 feet or something.
she's already over 5 pounds.
She's over 5 pounds, and that is good, because if you look at percentiles, she's well grown. And we do worry about growth in the setting of high blood pressure. So she's very well grown. She's real proportional. She goes in 34-week size head, 34-week size item, and then 34-week size leg. So she's perfectly proportional. In high blood pressure, sometimes we'll see a baby that has a normal size head that is small abscess, which means they're just the placenta starting to get out. That's beautiful, yeah. The placenta starting to get out now, getting everything you need for that placenta. Four chambers. That means your placenta is healthy, and 153 for heart rate. y'all want to keep the measurement?
Sure.
This is her little chubby inner thigh right here. This is her pelvis.
Does she have chubby?
She does have chubby thighs. This is a little lady right there. There's one and there's three. No, I can get it. I'll write it down. I'll remember it. That's pretty. Her bladder and then her pelvis still, and this is what she already was forming her bladder. A little deep. This means that she's a normal treatment cord, which I actually already knew because you can see the cord cross section. She's looking pretty good. Oh, she looks great. Oop, she's doing a lot of like another thing I'm checking what's called a biophysical profile. This is her movement. Her tone, her fluid, structure. Her breathing. Now, she doesn't breathe air, of course. Yeah, so air system there. Both is all dry down here.
I didn't realize it's that high.
Well, yeah, you have it on your forearm.
There's some parts of her that are that high.
Well, really.
I feel like lately it's been like kind of tender up there.
Your skin's stretching a little bit.
Because it's like when I push on it, it's like tender.
Well, I mean, the top of your uterus is right here. So here. And the top of your uterus is, it's going to be the tender part. It's kind of like you had a water balloon.
Like a higher
Kind of stretching out. It's exactly has the highest tension on it. It's very, very typical.
So I've noticed like it's getting harder to breathe and like it was kind of scaring me because she wasn't moving as strongly for a few days after I got out of the hospital.
Yeah.
And he called the nurse because I feel like I'm like over exaggerating or something. And she was just like, well, your wife is really tiny. All about that.
Beautiful.
There we go. She got her brain.
Perfect.
So what exactly are we like kind of looking for today?
We're looking for we're looking to see if there's any issues with her fluid, any issues with her size that would because sometimes women's blood pressure is normal and then their baby's just really small. We have to get them out earlier.
So because she's okay, we'll be able to
Because she's okay,
hold off?
we'll go. Yeah.
Okay, I wasn't sure which way that was going. Like,
No,
if she
because
was-
she's okay, the whole thing, you get like a really, because of the report card, you get a really good report card today from me that says, just for maternal indications, there's no baby indications to have her early, which is awesome.
I wasn't sure if it was like, oh, she's doing well, so we can take her earlier, or like.
Because one thing I can't tell without sampling, the only way to tell if her lungs is to actually take a sample of the amniotic fluid, send it to the lab, and get an answer back. And we rarely do that anymore. You either make the decision that you need to deliver for maternal blood pressure, or you just make the decision that she needs to go in.
That's what I'm trying to figure out, because she's so short that I won't go, and all I have is the blood pressure. There's no swelling.
Yeah, but we don't, because it goes up with movement, I mean, there's gonna be a time where even rest won't really bring it down. That's just what we've seen in history, That's what we've been doing this for a little while.
I just, because I could never get, like, I guess I could never word a question right, never figure out, like, how to ask.
Yeah.
I couldn't figure it out.
Most of our faith, your little thing. No, just because if she looks healthy in there, that's what it's like for. That's the way I feel like that. If there are issues with her birth, like her abdomen was small, her fluid was low, if I didn't see good flow in her placenta, then we'd start thinking about getting to the hospital and watching her closer versus, Well, that's her breathing. This is her lungs. And this is the diaphragm underneath the lung, and you see it going like down. It's called practice breathing. Very, very healthy. That's healthy.
Yeah. So I read that it, like, strengthens the diaphragm.
That's working.
Just gets it a lot.
Oh, yeah. No, I know. And the lungs can't really do anything to bring them out or to get rid of them. I figured
and I didn't do anything. I just
You did.
I was like,
You did. I still felt guilty.
for like 10 minutes she'll do hiccuping. I'm like, sorry. That'd be uncomfortable.
She looks great. Alright. I think I have the advantage, but I think blood pressure because people are so happier.